This is a drawing of a uterus. It's a basic drawing showing the outline of the uterus as well as the inside of the uterus. Now we're going to pan out a little bit so we can have a little bit smaller of a size so I can draw a few other things into the drawing. This represents a simple drawing of the fallopian tubes. And of course they're not exactly like this, but this will give you some idea of how they sit. Next to this are the ovaries. I'm going to add a little color to the drawing so that we'll be able to distinguish everything a little bit easier. This is going to be a dark red color representing the muscular portion of the uterus. Here you can see that I've added some labels. The ovary is here, and again on the opposite side. The uterus is here, and the fallopian tubes are also located on both sides, and that would be represented here. In the normally functioning ovary and uterus in a young woman, each month you will have a small portion of the ovary develop where it's trying to mature an egg. Once this egg is released, it will go into the fallopian tube and travel toward the uterus. During this same time of the month, the tissue inside the uterus will grow a little thicker. It will start out as a thin lining and become a little bit thicker and a little bit thicker and a little bit thicker until there is a large amount of tissue inside the uterine cavity. When a woman does not become pregnant, that tissue will be expelled through the cervical canal into the vagina. Here I have added some labels to show that the lowermost portion of the uterus is called the cervix, and this is directly connected to the vagina. Once all of the tissue has been released from the inside of the uterus in the form of a menstrual period, then the whole cycle starts over.